The president says he thinks Republicans and Democrats can work together to come up with a replacement for Obamacare. His remarks last night raised new questions about the future of that law that a judge declared unconstitutional on Friday, although Obamacare remains in effect. Here with some analysis on the political stakes, Rich Zeoli, host of his own, we hear, radio talk program on WPHT Philadelphia or around the world on the interwebs. Good to see you, Rich. Appreciate it. Is this a case that Republicans should be careful what they wish for? They talked about how bad Obamacare was for so long, and now they might actually have to come up for a fix for it.
Well, Leland, thanks for having me back. First of all, for Republicans, yes, they have to be wise to realize the pre-existing condition attack was a big deal for them in this last election. I mean, even people who supported coverage of pre-existing conditions were labeled as wanting to get rid of that coverage, and that attack definitely hurt people, no question about it. But Democrats have to be careful, too, because right now there's an opening for the extreme left of their base. I'm talking about the Alexandria Ocasio-Cortez clan to come out and say, well, now that Obamacare may be going away, let's just scrap it and do Medicare for all, this ridiculously expensive outrageous plan that no one even knows how much it would cost. And this opens up an invitation for Democrats now, gearing up for 2020, to out-left each other on this issue of saying, well, who's going to expand it the most and the most expensive? This could be a killer for them.
Interesting you note that, and you sort of heard the Republican counterattack on that from Roy Blunt of Missouri, saying Medicare for all means Medicare for nobody, as if sort of channeling exactly what you were thinking. This is how the American people look at President Trump dealing with health care. Only 33% of Americans approve his handling of health care. In fact, Obamacare itself is far more popular than the president himself. Problem? Question mark.
Well, it could certainly be a problem in 2020. It really could be. I think the president needs to come up with a plan, something, to lower costs, a free market approach without question. But there are some facts. You know, enrollment's down this year, Leland, as you know, 11% in Obamacare. Since 2008, the deductibles have rose 8 times faster than wages. Yeah. And so a lot of people are really hurting by Obamacare and the government's, quote-unquote, solution to the problem. So while there's an opportunity here, I think there's a real opportunity for Republicans to say, Democrats will raise your taxes and give you even worse coverage.
Real opportunity means having real solutions, not just talking about how bad Obamacare is. This from one of the very top young Republican political operatives in the country. In 2016, it wasn't just a winning issue for us. It was the winning issue, meaning repeal, replace Obamacare. They, meaning Republicans in Congress, botched the repeal bill so badly that by the end of 17, it was a total loser of an issue, and yet you don't see Republican congressmen coming out and saying, hey, look, here's our plan, here's 14 points of our new legislation, here's how we're going to do it.
Yeah, look, it's going to be a question in 2020, without a doubt, of what a plan replacement is going to look like versus whatever their plan is going to be. I'm not so sure.
But can Republicans afford to let this go to 2020, or do they need to be crafting some kind of legislation and start it in the Senate in the next couple of months?
Well, first of all, there's a question of whether or not this ruling will stand, and a lot of people aren't sure it will. So it may be still in the courts by then, so there may not even be a need for a replacement plan by then. So I think the real question is,
hold on,
can there be some...
Rich, Republicans have been saying there needs to be a replacement urgently for the past 8 years.
Right. And so what they need to do is they need to work on things to lower prices without having a lot of government control. But as a campaign issue, though, Leland, going into 2020, is the president going to be running against somebody who's saying, well, let's just forget it. Let's go Medicare for all, which is going to cost trillions of dollars. Let's just do that. And so the Democrats now are the ones coming out with a plan. And the American people are saying, as bad as this, quote unquote, Obamacare may be, that's even worse. Sometimes doing nothing, sometimes not coming out with a new plan is actually the best political strategy. I know that that doesn't seem to be politically correct or the conventional wisdom where they say you got to have a federal plan. Not always. Look, sometimes federal plans result in people paying higher, more deductibles and more premiums and losing coverage. And that's why Obamacare deductibles are down. So maybe the best way forward is for Republicans to sit back and see what Democrats do in terms of coming out with their socialist Medicare for all plans and scaring the American people.
Well, channeling the old Ronald Reagan, who said the most dangerous words in the English language are, I'm from the government, I'm here to help. We'll see if Republicans
and Obamacare proves that.
All right, Rich, appreciate it, buddy. Good to see you.
Thanks, Leland.
Nice analysis.